these truths to be self-evident.
That all men are created equal.
As a member of Congress, I get to have a lot of really interesting people in the office, experts on what they're talking about.
This is the podcast
For insights into the issues.
China, bioterrorism, Medicare for all, in-depth discussions.
Breaking it down into simple terms. We hold
these truths.
We hold these truths.
with Dan Crenshaw.
The Eagle has landed.
All right, welcome back, folks. Good time to have a conversation like this. We're going to talk about the budget. We're going to try to explain to you what the federal budget is all about, how it works, how lawmaking works, but how rulemaking works as well, which is an entirely different process that happens only at the administrative branch. And to help us with that conversation, we have a great guest today, Joe Grogan. Joe, I'm going to read your bio right now. Joe, thanks for being on. Joe's a healthcare expert, unique blend of private sector government experience, over 2 decades of experience in the Washington, D.C. healthcare arena. Prior to serving in the West Wing as domestic policy advisor, he was also the associate director for health policy at OMB, which shapes policy and directly impacts $1.3 trillion of federal health spending. So he's played a major role in a lot of the big healthcare battles that we've had here in the United States, and certainly under the Trump administration. He served as the special assistant to the FDA commissioner and executive director of the Presidential Advisory Council on HIV/AIDS during the Bush administration. He's currently serving as senior fellow at the Leonard Schaefer Center for Health Policy and Economics at the University of Southern California. And you got your own podcast, DCEKG. Podcast about politics and policy of healthcare in Washington. Joe, thanks for being on.
Thank you for having me, Congressman. I've been a fan of yours for a long time and followed you ever since your first campaign. So I'm really looking forward to this conversation.
I appreciate it. So I said OMB. I used an acronym. That's the Office of Management and Budget, and it's that's the budget wing of the president's branch of government, the executive branch. Is it not? Would we almost think of it like the appropriations committee of the executive branch? Maybe explain real quick in layman's terms what that is, what it does.
Yeah, a little bit. The appropriations committee is a little bit of inappropriate because, of course, Congress appropriates the money. At OMB, we're tracking the money and where it goes, and we're asking Congress for money. So we're requesting, and then we track when Congress has passed money to the executive branch to spend it. We're figuring out, A, is it going where it was intended? And B, when it's all said and done, was it spent appropriately? So sometimes doing evaluation. And frequently
Right.
what will happen is you'll have a new secretary pop up of, say, labor or health and human services or agriculture, and they'll come up with a new idea for a program. And they'll send it over to OMB saying, hey, we need to request money from Congress for X. And the career staff and the professionals at OMB will say, listen, we tried this in the 1970s. It was an abject failure, or the program would conflict with X law, or Congress won't want to do it for this reason. We're going to need a bigger policy discussion among, say, the Domestic Policy Council, National Economic Council. So it started as part of the Treasury Department, which makes sense because they issue bonds and they're tracking the fiscal picture. And then around 1939, Franklin Delano Roosevelt moved it into the Executive Office of the President. In 1970, I think, it became the Office of Management and Budget. And it's usually headed by one of the smartest people in the government, frankly. Under President Trump, it was Mick Mulvaney and Russ Vought. But guys like Cap Weinberger, who was no slouch and ultimately became Secretary of Defense, George Shultz, David Stockman, and you go through it.
Even the current one, I forget her name. The current OMB director.
I know it, and you just stumped me. But she's very good. And
she's good. We met with her in the Intelligence Committee surrounding intelligence budgeting, but also Ukraine. She is sharp, and so it's just letting people know sometimes there's good people even in this administration.
Right. And I think institutionally, it's generally more conservative than other agencies, culturally, even among the career staff, because their job is to watch the fiscal picture and the budget.
So who makes it's an imperfect analogy, right? Saying it's the appropriations, and I understand, you agree with what you said. But to an extent, it can be, because when we appropriate something in Congress, we can be very, very specific about it, or we can be kind of mealy mouthed about it and say, look, just to spend money, it should be for this basic thing. Is it in charge of the agency of jurisdiction then to figure out like what exactly to spend that money on, or does OMB have a role in that too? Or is it more of an oversight role?
No, it's a great question. I mean, you need OMB to sign off in conjunction with the agency. OMB will have to say, okay, say the appropriation committee passes $100 million and says to HHS, this is for pandemic flu emergency response or something like that.
Right. That's a very broad
They may come
term.
over, right? They may come over to OMB. They have to go to OMB and say, this is what we want to spend it on before they can spend $1. And
Right.
OMB will say, listen, we're not going to let you put it into this other account or do something that Congress or that you've been doing for the past 10 years. Congress passed you this extra $100 million for a reason, a new reason, and you can't use it for the old reason. So, and then if OMB thinks that an agency is screwing up and spending money inappropriately, or a program is being mismanaged, or maybe there's fraud, they can freeze money. It's within their authority. It's called an apportionment, and they'll freeze it and say, hold on, you guys can't spend any more money in this area. We need to sort this out. And then you begin to deconflict that disagreement or discrepancy.
It's a powerful place in the executive branch. And so I want to, there's a lot of wonky questions and kind of civics 101 questions that we're going to get to in this podcast. But I do want to talk current events a little bit with you, since you're a budget guy, and I'm sure you've been following it. And I want to get your just general take. So for listeners who aren't glued to not even the TV, because this kind of stuff doesn't even make it on the TV. What makes it on TV is members yelling at Hunter Biden for showing up because he wasn't going to show up. I'm very confused about that. But in any case, there's other important things going on, which is passing a federal budget, and we fight about it every single year. And honestly, it's Groundhog Day. It is the same conversations every single time. There are people who think we should do this and other people who think we should do that, and then you end up with some kind of omnibus. The situation recently is in the McCarthy days, not too long ago, there was a top line budget deal made, $1.59 trillion of discretionary spending. And that deal was made in conjunction with the debt ceiling increase. Some conservatives think that's a good deal because it's the best you can get given the political circumstances and realities. I'm one of those conservatives who believes that we live in the reality we live in, not the one we wish we lived in. And there are others who think that, no, I mean, look, I could have done better if we could have just fought harder. And that conversation was the same back then. People voted against it. I think it ultimately led to, an appropriations process that ousted Speaker McCarthy. We get Speaker Johnson, who is in the exact same political circumstances that Speaker McCarthy was in, if not worse ones, because we actually have a smaller margin majority at the moment because of a couple of retirements and George Santos being expelled. So, like, the wallpaper of the room and the lighting in the room and the carpets and the drapes, they're all the same, And the political realities are all the same. And so we're back in this exact same position where Johnson goes and is doing his job here. He's striking a deal with the White House, with Schumer, to say, look, this is our top line. They come up with basically the same top line that McCarthy did. Johnson argues with that he got a few more concessions about the side deal that apparently occurred. And so it still doesn't make some hardliners happy, to the point where they actually took down our rule yesterday. And that means I'm going to have to explain all of these terms. Taking down a rule just means that you basically make it impossible for us to pass our bills for the week, because we can't pass a rule. A rule is just what you have to pass before you vote on the bill, because it's the rule that governs the debate of the bill, let's say. And so that's a whole other deep dive into how our legislative system up here works, and whether it's necessary or not, it's a whole other question, but that's how it works. And it's like your first indicator of whether you're going to have support for the ultimate bill. And I think 12 Republicans voted against it. as a rebellion, as a message to Johnson that he's got to fight for something better, which they'll never
Mhm.
support no matter what he gets. So what's your take on all this, and the budget process in general? I kind of want to talk about that.
Yeah, look, uh, I'm both in. I've spent a lot of time looking at this process and at various budgets and various spending deals. There, it's difficult not to be cynical over the long term. The number of times that you see Republicans and conservatives say that they're going to do, and frequently presidents in presidential campaigns will say, "I'll get control of the deficit, I'll get control of the budget," and yet they get in and they get pressure from various congressional offices, and they don't cut spending. Same thing with members of Congress who campaign on cutting spending. Then they get in, they realize how hard it is. I mean, I think the dynamic you're talking about with people sinking McCarthy and saying it's overspending, the reality is with only a few seats, less than a handful of seat majority currently, because to your point, the resignations, you're and you only have one house, right? You have the House of Representatives. Winning the political and the practical fight of slashing spending dramatically is really hard, if not impossible. Like, I don't see how it gets done in the next few weeks that you have an upending of the big deal. Generally speaking, uh, I think Biden is the biggest spendthrift, the most indifferent to the budget deficits and national debt of any president that I've seen. I was a little guy when Carter was president. Reagan cared about the deficit, but he had a Cold War to win and he needed to get our economy moving. But Bill
Yeah.
Clinton, he cared about the deficit. Obviously, George H.W. Bush, he got backed into a bad budget deal in order to address the deficit and basically lost re-election because he raised taxes around it. But these guys in the Biden administration, they're just completely indifferent to it. I mean, they don't care. We're at almost $35 trillion in debt right now. At some point over the coming decades, the money's not going to be able to be borrowed anymore. I know that's inconceivable to the American people who've been able to just issue bonds. It's the safest investment in the world. And we've been able to spend more money every year than we have coming in. We have a real luxury in being the world's reserve currency. But my big fear is if we don't address this in a sober way, on a bipartisan basis, and I think that's the other thing, Congressman, it's got to be done on a bipartisan basis. Democrats traditionally have been way too cynical about as soon as Republicans propose a cut, they will come out and say, "Oh, it's all about benefiting the rich." Republicans, frankly, sometimes have not been willing to put their money where their mouth is on cutting, but no one party can do this. And it needs to be done on a bipartisan basis, but we are running out of time. To your point, it is not going to be fixed over the next few weeks. Republicans just don't have the political horsepower. They've only got a few seats. They don't have the Senate. They don't have the White House. Game over, as far as I'm concerned. And the deal that McCarthy negotiated and now Johnson, is it perfect? No. Does part of it bother me? Sure. But what are you going to do? You're going to shut down the government indefinitely? I just don't think it's a practical course of action right now.
Yeah, there's a line of thinking that says, yeah, if you shut down the government, you go to that brinksmanship, and then you're going to gain some wins out of that, inevitably. Um, has that worked out for us in the past?
We consistently lose these fights. Going back to Newt Gingrich with, the big fights against Bill Clinton and the extended shutdowns. Bill Clinton was a far better communicator than Joe Biden. But look, when you start having real pain for people show up at national parks and their vacation is canceled and they see a sign that says up there, Congress didn't do their job. We don't have any money to let you into the national park. American citizens are ticked. They have the right to expect that Congress is going to do their job, appropriate the bills, and the theoretical, the future harm of not getting the budget. The budget under control becomes abstract in those circumstances when your paycheck doesn't show up, when road construction project seats, when your passport processing or national parks get shut down. And if you're in the executive branch, you have far more flexibility with the communications and to figure out what gets shut down or not to inflict the maximum
Right.
political advantage over the other party.
Well, the other political problem with this is when we're arguing about these spending cuts, we're arguing about it. I think about 11% of the budget is my understanding. This is
Right.
based on our conversations during the debt ceiling negotiation. And so where do I come up with that number? Well, 2/3 of the budget is mandatory spending, which has nothing to do with these budget fights. And that's Social Security, Medicare, Medicaid, all of these things. And we'll get into some detail later on maybe how we can save money there. But that's 2/3 of our spending. And that's entitlement spending. That's, that Americans feel like they paid into that their whole lives because they did. It comes out of your taxes. It comes out of your pay stub every month. That there's money in there that's going directly to your grandparents, and in the form of Social Security or Medicare benefits. And so when they're finally getting those benefits, that's a hell of a political problem to try and take those away. And Democrats are very quick to say, well, no, you're going to throw Granny off a cliff, right? We all remember when George W. Bush was trying to reform Social Security. If he had been successful, we'd probably be in a much better fiscal place right now. But it failed because of the Granny off a cliff argument. And so then the rest of the budget is discretionary, but over half of that is defense and VA, you know.
Right.
And so now you're talking about a very small portion of the budget to work with. And even, and my question to, my fellow colleagues who think we can get something better is like, what is better? 10 million, 10 billion, 20 billion, 50 billion, maybe 100 billion even? Like, that's a drop in the bucket, frankly, when we're talking about the federal budget. And especially my main problem politically with this is, let's say you do extract additional cuts. What you've also done is, I think, exhausted your leverage by that point, right? And you can claim all the wins that you want. They probably still won't go for it. And now you've exhausted all your leverage when we're desperately trying to keep leverage in place for a border policy deal, which is supposedly everybody's priority. And so there's a lot of dynamics here, which is why I'm a bit frustrated with what I think is a little bit of a lot of grandstanding, kind of a fake outrage about, discretionary spending and saving of, these, what are in the end, tiny cuts compared to the overall budget.
Yeah, I mean, I think you're right. Look, I'm not. I think Medicare as a good example of a mandatory program. Mandatory program is basically it goes out by statute. You can't cut it every year, or add to it every year with appropriations. A lot of it is done by formula. I mean, obviously, you can create an extra program in Medicare or an extra benefit, but it comes right out of the Treasury. It's not formula like defense, where the Appropriations Committee says we need this many dollars for the stealth program, this for a new aircraft carrier. And to your point, we live in a very dangerous world. There's not a whole heck of a lot on the defense side when you've got all the things going on that Congress is going to be able to cut from. I mean, you may have suggestions from your own experience and expertise of things that the Pentagon wastes money on, but generally speaking, that area as a part of discretionary uh, spending, you can eliminate certain programs, but you really can't slash that sucker in order to take care of the mandatory side and balance the book. So you have to address, to your point, Social Security and Medicare. Now, Medicare, in my opinion, having spent time looking at this and coming up with good proposals from President Trump, you can do things in Medicare that do not hurt patients. In fact, help patients and help them on their bottom line, but increase efficiencies and force companies who are receiving U.S. tax dollars to perform more efficiently and do better job. And you can clamp down on waste, fraud, and abuse. And you can really start to rack up hundreds of billions of dollars pretty quickly if you do some things. I'll give you one example. Let's suppose you need knee surgery. If you're on Medicare, it costs you a lot more to get that knee surgery done in a hospital than it does in a ambulatory surgical clinic, which is
Right.
basically a specialty clinic where you have people that just do surgery on joints, for instance, and maybe some bone. They're specialists in that area, and they don't have all the infrastructure of a large hospital. They can do it more efficiently. They're specialists. This is a discretionary or specialized surgery. Now, why not encourage more beneficiaries to go to those ambulatory surgical clinics? In fact, lower the price that the hospitals get reimbursed to push more people into the ambulatory surgical clinics and make the hospitals think about trying to find efficiencies. It's less cost effective for you to get it done in the hospital. Now, if you're really sick or you have complications, say you're diabetic, yeah, fine, get it done in the hospital. There may be complications you have to worry about, but for the vast majority of people, you can save money and probably get better outcomes by having it done in a specialty clinic, and you're not cutting a benefit to a American taxpayer who's paid into the system. You're cutting the reimbursement rate for an inefficient service. And that is there are these things all over the board.
So the CMS does not allow you to use an ambulatory specialty service for, say, a knee surgery for a Medicare patient?
What they'll pay far less for the ambulatory surgical clinic. So the motivation frequently is the hospital will buy the ambulatory surgical clinic, call it part of the hospital, so they can increase the price at the ambulatory surgical clinic, buy the ambulatory surgical clinic, and push it out of business, buy the practice group, and so that they can bring those surgeries into the hospital at a much higher reimbursement rate. We had proposed it in several budgets to Congress to say, please change the law and allow us to drive these costs down and make it more attractive for patients to choose the ambulatory surgical clinic and less attractive for hospitals to buy those practice groups. Congress didn't want to hurt the hospitals, so it wasn't. And Democrats were able to say,
Well, they're strong. They're a strong constituency. I mean, yeah, because we hear all the time, and it's hard for us to know what's real and what's not in the healthcare space as policymakers, because we hear from insurance, we hear from doctors groups, we hear from patient groups, we hear from hospital groups, we hear from drug groups. It's everybody has different stories in the healthcare space. They're all conflicting with one another, and they're all on the verge of collapse, according to them.
Right.
So,
right.
Like you talk about, because what a hospital will say is, look, I mean, Medicare already pays us at 60% of our costs. Like that's what they'll say. And I have no way to disprove that or not disprove that. One of the things we've done recently is force price transparency, so that there is a way to actually assess price signals. And yeah, maybe that'll be helpful. Of course, they hated that. The hospitals hated that.
Right.
I mean,
Continue to
healthcare is
fight.
just, it's good to, so there's no easy buttons, it seems.
No, there aren't. And it's so heavily regulated, to your point, that you have different commercial actors showing up and saying, I'm not the problem. My company, my hospital, my pharmaceutical company, my device company, my clinic, my practice group, my reimbursement, I'm not the problem. It's so-and-so over there that's the problem. And
Yeah.
unfortunately, it's like regulation 101, central planning 101. The more the government gets involved in regulating these things, the more screwed up and irrational the market becomes. And unfortunately, you as a patient, me as a patient, John Q. Public are not empowered to make these decisions, to choose the best care. They frequently don't have the information they need, and they don't have the economic incentives, unfortunately, to
Yeah.
make the right decision.
Well, if you were to just start a society over, and there are no regulations, there's no laws, and you just get to actually build it from scratch, which I think is a useful thought experiment, because I think one of the problems for Republicans in trying to ascertain where we're at on a healthcare policy basis is that we actually don't have a really solid utopian end goal in mind. That, look, we wish the system were like this. We've never been able to say that to anybody. The Democrats
Right.
do. The Democrats are very clear about what their end goal is, and it's a single payer system. It's healthcare is, from the patient perspective, is free to you. Yeah, you pay a lot of taxes, but you never have a medical bill. That's like maybe not all Democrats, but that's the Bernie Sanders view of healthcare. And so that's a
Right.
very simple thing to explain to people. Republicans have nothing similar to that. And I've tried to develop something, but if you could just start from scratch, forget about trying to nitpick and fix all of these difficult problems that we currently have because of our current system, what would a proper healthcare system look like that accomplishes a couple of things? We got to put some guardrails on this thought experiment, which is, Um, it does give people access to healthcare. Right? It doesn't leave people out of the system. So that's an important part. I think we should agree with Democrats on that. It's not a right per
Yep.
se, but it's a thing people need. Two, that it's affordable, and three, that it still fosters innovation. Right? It doesn't kill future innovation, because we're like the only country that really does it at scale. So how would that look?
Well, first, I think those are great principles that you just articulated, like off the top of your head. Those are three great principles for how we as Republicans should approach healthcare, how we should articulate our vision for healthcare. If you think about health insurance from a blue sky approach, I would suggest that we should view it the same way we view homeowners insurance or car insurance. You don't use your car insurance to go get an oil change or to get your tires rotated, nor do you use your homeowner's insurance to get the house painted. Insurance should be used for when you have a real problem, you have a catastrophe, you
Right.
have something really bad happens to you. Okay. That's number one. It shouldn't be used for routine visits to the doctor, checkups, and routine expenses. Now, the next thing you want to get to your point about cost and access, I think we can get to a system in the United States where between a series of tax credits and subsidies, you can put into people's accounts, if they are below a certain earning threshold, a allotted amount of money that's their money that they could spend on healthcare as they see fit. And if they get $3,000 in year one and they don't spend that, they only spend $2,700. The $300 stays in that account and grows with interest. So, and if you start young enough when people are relatively healthy, this money could really grow so that to insulate people. And then they're price sensitive a little bit more as they're shopping, for instance, and they say, I want the generic versus the brand drug. I'm going to shop around for who's going to get me the best deal on the knee surgery. Now, you need transparency in that instance, but you're going to get it if patients are actually shopping and saying, I need to know the price and I want to know your outcomes. How good are you guys? How many adverse events did you have last year? Who else, how many knee surgeries do you do every year? And you can get to a system where patients are at the heart of it and making the decisions with their doctors. And unfortunately, we have a system right now where the bureaucrats are making these decisions about what you can spend your money on and what insurance product you can buy, saying you can't buy X, Y, or Z. And you also have people with masters in business administration at big insurance companies or big hospitals saying, this is what we'll pay for, this is how we're going to cover it or not, which is insane. That's not how this should be done. It should be about you and your doctor first and foremost.
And well, that's the thing about healthcare is you can't make it if you left it. This is one of those things. If you completely leave it to the free market, it won't work. Like, because it'll leave people out.
Right.
And so it has to be the right mix. And yeah, and I agree with your kind of utopians. I've described it as such before. I came up with those three principles, not off the top of my head. I've made
I'm
this speech
sorry.
many times, but I appreciate it. Thank you. I've talked about this a lot. And so those three principles do guide us into the direction you just set, right? It's a health savings account that everybody has, and you have one debit card, and that's your healthcare spending card. And if you're poorer than everybody else, like maybe the government puts some money into it. And we can sort out whether maybe that's the money you use to also pay for your health insurance. And now systems like this are kind of popping up, right? I mean, this is it's happening on its own in some places. And it's a real question for us as policymakers as to whether we should just force it. Because if you're really going to create that system and make it work together, and this was kind of this is what Obama argued about Obamacare, this is why they argued for the tax against you if you don't buy the health insurance, because no matter what system you come up with, it actually doesn't work very well unless everybody is a part of it. And that makes this whole problem very, very difficult to try and maintain all of the principles we outlined with some freedom of choice, with some quality of care, with some room for, with some profit incentives for innovation. It's hard. And so, yeah, that HSA account kind of idea that you have your account, that's your healthcare account. You use that to pay for, your random visit to the doctor that wasn't a big deal. Then you have a more catastrophic event. Then you ask your insurance to pay for it. Curious what you think about, what about really, there's catastrophic events and then there's like really catastrophic events, and so let's differentiate between the two. I mean, a catastrophic event would be a car crash, bunch of broken
Right.
bones, lengthy hospital stay. That's an expensive issue. But you eventually heal.
Right.
Cancer treatment for 10 years that's a whole other ball game. So, and there is a market for this where you basically buy life insurance and then you pull out of your life insurance to pay for those kind of catastrophic events. What do you think about that?
I think, um, we need to have more innovation on the payer and reimbursement side that is not allowed currently under the various some state insurance laws, but critically under the Affordable Care Act. They
Mhm.
don't allow, there should be a whole bunch of a variety of different high deductible healthcare plans being marketed to people. I talked with somebody recently who had been about to launch a
And the
specialized.
high deductible healthcare plans, just to be clear to people, it is that basically means what we were talking about. Because a high
Right.
deductible means you have to pay it's like a $5,000 deductible. I would consider that high, I guess. I'm not sure if
Right.
that's technically high. So
Well, Obamacare is there now. Many of these plans now, you have a 5 to 7, $8,000 deductible, even though you're in Obamacare, which is
so
also
that
a barrier. It's
so
getting
that
people to.
does make you, but high deductible does make you price sensitive to those lower level, like painting the house, changing the tires type of healthcare, right? So it does. The problem is people are paying two things: their premiums, which are still high, but also that 5,000, because they rarely go above the $5,000, so they're still paying it anyway. And so people are like, why the hell do I have health insurance? Then a lot of young people
Right.
don't want to buy health insurance. I would have
And
a
then
problem buying health insurance if I didn't have like my military VA stuff. Like I would be like, why am I paying into
get it.
this? I'm just not unhealthy enough.
Exactly. And you not only, you don't have the health savings account in the Obamacare plans, right? And, so people frequently don't get care. If you're, if you're healthy, if you're a young, healthy person, you're like, what am I paying for all this every year? And I'm not using it. And if you're sick and have family members who are sick, you can really be in a tough spot. I mean, yes, cancer care for 10 years is catastrophic, but think of a family with, say, a child with a genetic disorder,
Oh yeah,
that is gonna
lifelong.
be a
Yeah,
lifetime of care. And to your point about how you could create a market to insure these people, who have really serious problems, you could have in the catastrophic insurance pool, you could create a national risk pool based
yeah,
upon their indications or their costs. Before it was outlawed by the Affordable Care Act, Maine had just launched a risk pool based
right.
upon the type of illness that people had when the
Are they are
Obamacare
they
wiped.
s- are they still allowed to do the reinsurance idea, which is similar? Is that
Yes,
still?
reinsurance's market got severely impacted by the Affordable Care Act and was a more robust market, but it does still exist in a number of areas. The problem is, with a smaller number of reinsurers, if a insurance provider has a few years where they've gone over and they're starting to tap into that reinsurance, suddenly you can have a massive increase in the rates that the insurer has to provide. But the one point I want to hit on quickly is, the taxpayers are spending this money now, and it's not going to the patients to make these decisions. It's going to the insurance companies. The Obamacare subsidies go to the insurance companies
Right.
who have to sell products that the government dictates. This is all the stuff that you need to have in here. And then with a total inability to innovate, all they're left to do is increase premiums and increase the size of those deductibles. It is a very poorly crafted law from a healthcare perspective and an economic perspective. And
Is there a
yes, we
good
got smoked.
is there a
Sorry.
good bill
I was
out
gonna say,
there
well,
that like no, we'll go ahead. We got smoked out.
I was just gonna say we lost the fight on repeal and replace for a whole host of reasons,
Yeah.
and one of them was lack of having a good plan, if not the principal reason. But um, it doesn't mean that the Obamacare is perfect, and we can't take another run at making fundamental changes to this and putting that law on the side of A, patients, and B, taxpayers before the big corporate players who are making a ton of money off the Affordable Care Act. We have terrible outcomes, and people aren't getting the care they deserve.
Yeah. Are there some bills out there that you think are sitting on the shelf? Obviously, this debate's been raging for a few years that we should be taking up, or do we honestly need to go back to the drawing board when it comes to a tactic to reform Obamacare?
Yeah, here's the problem. Why there isn't a perfect bill, in my opinion, because Republicans have got themselves in a box that if they propose a bill that amends Obamacare, they'll get attacked from the right by saying you're giving into Obamacare and you're capitulating. And Democrats don't want to introduce reforms because then they don't want to have to admit that the law is screwed up. And they're afraid what Republicans will do in coming in and trying to ask for even bigger changes. But there is a there is almost perfect agreement among any member on Capitol Hill and their staff that the Obamacare is screwed up. Guys like Bernie Sanders want to move directly to single payer. It was always their goal, and any
Yeah.
incremental move in that direction, that's what they want. But nobody is going to sit there and say that the Obamacare doesn't need to be fixed. Even uh, Senator Warren from Massachusetts raised really good um, uh, points about some of the financing mechanisms and some of the economic incentives that are screwed up in the Affordable Care Act and that they need to be addressed. So I'm hopeful that in the future we can have an honest discussion and take your principles and say, okay, let's apply that to Obamacare. Let's make sure that this law becomes on the side of patients. The money is devoted to the patients and their care
Yeah.
and not to corporate
Well,
interests.
I mean, you're describing the politics of it, but I mean, from a policy perspective, if you could just wave magic wands, is there a good reform bill out there, or at least a set of reform bills out there that, because, my experience, working on the healthcare subcommittee here in Congress is we're not having a ton of conversations about the financing and Obamacare at all. We're just not.
None.
Because
Yeah.
Republicans had PTSD from it, from before when I got here, right? That repeal and replace happened before I got here, and there was pitchforks and torches and everything for members of Congress who wanted to touch Obamacare because it's very personal to people, and so I don't see a lot of conversations about this. And but the starting point for any conversation is policy, making sure the policy's right. Then it's my job to sell that politically. Um,
Right.
but it's not even clear to me like what that perfect bill is. There's a number of them that are out there, but
Right.
we've got to
Right.
reignite that conversation and probably refresh some of the policy proposals.
Yeah, I would agree with you completely, and nothing beats the committee process to having good members and their staff work through issues like this towards a bill. I think one thing I would say is after the Affordable Care Act crash, and talk about PTSD, those of us who were in the Trump administration at the time, you could ask us, and there would be some common themes as to why it fell apart, but not everybody has the same reason exactly. I personally think one big mistake we made was combining the Medicaid reforms with the Affordable Care Act, insurance market reforms, and tax reform. So I would break those up in two. I would fix the financing for Medicaid. The Affordable Care Act created this bizarre financing structure where a healthy, able-bodied uh, adult who can work is reimbursed by the federal government at 90%. So only the states only have to put 10% in. But a pregnant mother who can't work because she's the primary caregiver and has no child care, she is only reimbursed around 50% by the federal government. So the motivation for the state is to get people who can work onto Medicaid as opposed to people who really need it. That
Hmm.
that needs to be, rectified in a big way. I don't deny that, if you're poor, you need to have care and the Medicaid exists for a reason. But you can change a number of the fraud and eligibility levels and change the financing and give states more flexibility. I'd love to see something like block grants for states with some broad parameters. Maybe that's too difficult politically. Definitely a lot more flexibility for the states as we fix the financing. And
Yeah.
then I would look at the principles that you outlined for the premium tax credits and the insurance market. And I would say, how do we apply these principles to get this law on the side of patients and their relationship with their doctors, make sure they get good care and restrict and blow open the restrictions from the insurance markets. You should be able to buy all sorts of different insurance products. I mentioned before, people I meet, they wanted to, they've got all sorts of ideas for innovation in insurance. One group I met, they want to do one for people who were runners, people who had great cardiac but might need more joint care, and so they would get a specific type of benefits in that, and have access to specialists to help them keep their running careers going, and be able to buy in and get those services more cheaply than maybe some of the other things that is less likely to affect somebody who's running in 3 or 4 marathons a year. But the Affordable Care Act prohibits that, prohibits all these sorts of creative innovations that we see in the financial markets. We see in across various industries when people want to want
Yeah.
when the American people want to innovate.
Yeah, it's like a protect you from yourself kind of mentality that is pretty prevalent when Democrats write regulations. Maybe the last thing I want to talk to you about it called votes, I think. So we're like having to leave soon, but probably has a little bit of time. Um, is it, we talk about the deep state. We talk about cutting red tape, cutting regulations, and politicians will stack up big piles of paper and say these are all the regulations, and whatever, they get cut or they don't cut. I mean, they talk to us about like how lawmaking is lawmaking. Okay, that we introduce a bill, it goes through committee, we vote on it in the House, vote on it in the Senate, and the president signs it, it becomes a law. That law usually instructs an agency to do something, and then that agency has to figure out how to do it. And so they do rulemaking. They write rules and regulations that are supposed to be authorized by the law that was passed. So maybe talk about that real quick, and how hard it is and why it's so hard to actually rein a lot of those in. Like, what are the challenges? If President Trump is back in the White House, like, what should he do differently this time if he actually wants to cut red tape?
Right. Well, look, I think one of the great successes was his deregulatory emphasis. I mean, it was from the moment he came in, he said, we're going to deregulate. His instincts were awesome on deregulation. I think it stemmed from his experience as a builder in New York and the amount of regulations he had to fight in his commercial life. I mean, you think back, we built the World Trade Center in like 390 days or something crazy, just a year. Excuse
Yeah.
me, the Empire State Building. It just took about a year. Now, how long would that take? At least 2 decades of environmental reviews, lawsuits, all that nonsense. And you can't move things forward. But his instincts were awesome, and it was the most fun. Frankly, it was one of the most fun parts of my job was to identify regulations that could be undone, could be pulled and completely withdrawn, or when an agency came to you and said, we want to regulate in this area, to be able to push back and say, no, did you not see the president's speech? We are a deregulatory agenda. He has an executive order on this. He did an announcement for every 2 regulations. For every regulation you want to put forward, you have to cut 2. So give me 2, and then we'll talk about this other one. And he was very strict in putting something called administrative pay-go, which means you have to balance your books. If you are going to do a regulation that's going to cost the government money, you've got to cut in another area. And we were mocked by this by a lot of liberal economists, frankly, who said, oh, regulation doesn't impose any burdens upon the commercial sector, any significant ones upon people's commercial lives. Well, I mean, look at the example of the Empire State Building. I mean, that's just insane. You think about all the jobs that are created when you're putting a building together. And then, oh, by the way, by having the building, right? Like, liberals frequently think you get the economic activity from building a bridge or a road. No, it's the existence that moves people from A to B. I think whoever becomes, you've got 3 presidential candidates on the Republican side right now that are still fighting for votes and viable. I would think Nikki Haley, DeSantis, or President Trump, any one of them will follow Trump's example and be deregulatory because it was so successful. The enthusiasm among so many of the veterans of the Trump administration, the economic numbers that show the benefit of these, and we created whole markets that didn't exist and allowed innovation to flourish in different areas that didn't exist before.
So
And
if
some of those things,
if there's will
right?
from the top, is it easy to just cross out some of these regulations, or I mean, does it depend on the regulation? Because you'll
It,
run into legal challenges, et cetera. Like, how does that
yeah,
work out?
you run into legal challenges, and there's a process to everything. And Trump would always be frustrated that, hey, why isn't this removed? I told you to remove it 48 hours ago, and
Yeah,
I got to
I
call it.
tweeted it. I'll do it.
Yeah, and you're like, listen, we got to put a notice in the Federal Register. We got to, notice and comment rulemaking. We got to make sure, to your point, we do a legal review and do this the right way. The American public needs to know that this is happening, and we don't want to get sued and then have the whole thing collapse. All this frustrated him, but the thing is, it made it crystal clear this was a priority for us to get done. With a guy like Trump, who just was like, in your face all the time about delivering on what he told you to do. There was a tremendous impetus to get these things done. It was in all the areas of policy that he pursued. Um, I think from an imagination perspective on the conservative side, he blew through some barriers that were thought to be inviolate before. I worked in the Bush administration. We regulated a lot and frequently as the first choice. We'd say, well, we could do a regulation here and do a press release and we'll have an event. Trump would do it around deregulation. He'd be like,
Yeah.
no, I'm not doing that. I'm talking about how we're going to get the American people outside of this burden. So it was great, but it does take time to do it right.
Yeah. Got to go vote. So we have to wrap it up. But this has been great, very helpful, and maybe look forward to doing it more often as we try to unravel what exactly the right healthcare policy looks like in America and how to achieve it. It's a constant question for conservatives, and also how to fix the budget process and fix our regulatory frameworks. All easy stuff. Joe,
Yeah,
thanks
I
so,
know. Well, thanks for it's inspiring for me to talk to somebody like yourself who has so many issues that you're involved in and speaking out on. I'm a right winger who firmly believes Republicans have to fight and win on healthcare if we're going to have a workable majority and win elections, because the Democrats don't just want to protect people to their own detriment. They want to control them. And if we believe in liberty and we believe in fiscal sanity and we want good outcome for patients, we have to do a better job on healthcare.
Yeah, no, we gotta show up to the fight. Most people are afraid of it because they have no idea how to talk about it. Right? A lot of passion,
Right.
but very few people in Congress really dive into the issues. And look, I learn something new on healthcare policy every single day. It's the most
Yep.
complicated policy issue probably that I would say we have in government. Joe, I gotta run. Thank you so much for being on.
Thank you.